What happens when a common medical condition goes unaddressed because the symptoms don't match our clinical expectations? Cultural portrayals often equate depression with crying or profound sadness. However, in older adults, the condition frequently manifests through different, less stereotypical markers. At 72, James retired with plans to travel and focus on his hobbies. Instead, he experienced a gradual shift in his daily drive and outlook. Because James didn't exhibit standard sadness, the link between his declining activity and his mental health remained unrecognized by those around him. The change was incremental. James withdrew from community events he once enjoyed and eventually stopped reaching out to his social circle. He struggled with his physical health during this period, specifically noting a lack of energy and persistent unexplained fatigue. James and his family reached a common conclusion. They assumed his exhaustion and social withdrawal were just expected results of getting older. Normalizing these changes as an inevitable part of the aging process prevents many seniors from seeking the medical support they need. Organizations like the World Health Organization report that geriatric depression often bypasses traditional emotional markers. Patients often report physical complaints like persistent aches, fatigue, and disrupted sleep. These are frequently accompanied by behavioral changes, such as irritability and a lack of motivation. In older populations, these shifts are the primary indicators, while standard sadness is often completely absent. Effective diagnosis requires evaluating these physical reports as indicators of a change in emotional baseline. Vulnerability is often tied to life events, like the loss of a routine, the demands of caregiving, or increased isolation. James navigated these changes for months before mentioning his lack of energy at a routine checkup. During the exam, his doctor identified that James's physical exhaustion was a symptom of a treatable mental health condition. Clinical research emphasizes that depression is a manageable medical illness, not a requirement of growing older. Maintaining quality of life requires the same clinical attention for emotional health as we provide for cardiovascular or cognitive wellness. Following a treatment plan, James reconnected with his community and found that his physical energy began to return. His experience demonstrates how specific habits support emotional resilience and help rebuild health in later life. Physical habits are the first step. Consistent daily movement and prioritizing restorative sleep provide the biological foundation for mental wellness. Psychological habits follow. Maintaining a structured routine and seeking social connection are practical ways to prevent the isolation that often triggers decline. If you notice persistent withdrawal or a lack of motivation in yourself or a loved one, consult a healthcare professional. Combining these emotional habits with physical care creates a durable foundation for healthy, independent aging. Growing older does not mean losing joy, and reaching out for emotional support is a truly profound act of courage. In our next episode, we will demonstrate 5 daily stretches every senior should do to improve mobility and physical comfort. Protecting your independence means caring for the whole person, integrating the health of the body, mind, and spirit.
Remember, life after 50 isn't about slowing down. It's about living stronger, healthier, and happier. If you enjoyed this video, please like and subscribe, and share it with someone you care about. This is Longevity After 50, adding life to years, one step at a time.